Thank you, Andy, and thank you, members of the press, for joining us, especially on almost a last-minute basis here. But we did have some important news that we wanted to share with you. But before that, we'll talk about the numbers around Northern Light Health. As of this morning, we have 46 total inpatients within our system who are positive for COVID-19. 4 of them are at A.R. Gould Hospital, 29 at Eastern Maine Medical Center, 1 at Inland Hospital, 2 at Maine Coast Hospital, 1 at Mayo Hospital, 6 at Mercy Hospital, and 3 at Sebasticook Valley Hospital. In addition, our home care and hospice team is taking care of 2 patients at their home who are positive for COVID-19. I want to talk a little bit about our COVID positivity rate. So the positivity rate is the percentage of tests, of all the tests that are run by Northern Light Health that come back positive. Over the last 2 weeks, that averaged out to 7.19%, and over the last 7 days, 7.78%. So we can understand what those numbers mean. As we started the school year last year, at this time, the positivity rate was 0.5%. As we looked at just the beginning before November and December's staggering increase in hospitalizations last year, the statewide positivity rate was just below 2%. So these numbers are far larger than we saw before. And as the COVID cases across the state continue to increase secondary to the Delta variant, Northern Light Health reviews all of its visitation policies at each of its member organizations. We ask that everyone please review the visitation policy at their local hospital prior to coming for visits, as they may have been changed. These visitation restrictions and/or changes may be found on the website of the hospital or their social media pages. Turning to today's news, that the Pfizer vaccine has received full FDA approval for those 16 and older is a milestone in the fight against the COVID-19 pandemic. This approval means that this vaccine has met the rigorous safety standards of the FDA. We hope that this authorization will allay the fears of those who had expressed concerns about the safety of this vaccine and give the people the confidence they need to be vaccinated. This is the most well-tested research vaccine with more than 200 million doses administered nationally. And with that, I'll turn it over to Paul for some updates about our staffing.
Thanks, Dr. Jarvis. And so my updates are brief in that we continue to work with our employees who are yet to be vaccinated with regard to the state requirement for healthcare workers that they be fully vaccinated by October 1st. At this point, we have just over 84% of our entire employee population vaccinated and more being vaccinated every day. So we are seeing positive movement in terms of vaccine hesitancy being allayed through the state requirement. But in addition, as Dr. Jarvis mentioned, the new full approval by the FDA of the Pfizer vaccine, we also expect some of the hesitancy and questions that employees have had up to that point to be resolved through this FDA approval. So we're very, very pleased with that.
Thank you, Paul. And with that, we'll open it up to questions. Andy?
Okay. Thanks, Dr. Jarvis. Thanks, Paul. We'll start today with Blake, BBC7. Blake, you should be able to unmute now.
Can you hear me?
We can, Blake.
Yes.
All right. My first question is, I know it's been a relatively short amount of time since this was given full approval, but today, have you seen any healthcare workers come forward and say, now that it's gotten approval, I want to get vaccinated?
Yeah, I have not had any direct conversations in that regard, and I'm sure Paul will.
Sure. And I've had one of my own staff in the Human Resources group had indicated that they were hesitant because of the lack of the full FDA approval. And so that person had committed that they would be vaccinated as soon as they were able to following the FDA approval. So I'm looking forward to following up with that person. But that's anecdotal, but I know that there is at least one, and I know there are others from what I've had in terms of talking with other leaders and staff throughout Northern Light. All of the reasons and questions that we can answer along the way to resolve reasons to be hesitant to receive the vaccine are a help. And so this will be one more checkbox completed in terms of a reason to be hesitant. This would remove that, and so we're pleased that that's the case.
And I think just in general, do you expect more of your employees and staff to come forward and get the vaccine now that it has been approved?
Yes, it's a job requirement now, as the state of Maine's law requiring that all healthcare workers across the state be fully vaccinated, meaning 2 weeks following their final dose of vaccine by October 1st. And so it's a job requirement, and so I certainly do expect the remaining staff to become vaccinated between now and that time.
Brian, thank you, Blake, for your questions. Next we have WADI. Brian, you should be able to unmute him.
All right. Hey, guys, can you hear me?
We can.
Kim, Ryan.
Okay. I just wanted to know if you could maybe expound a little bit. I know it seems silly, but why it's so important that the Pfizer vaccine has been FDA approved.
Yeah, so Brian, that's a great question. So I think the importance there is that it shows that what we've been saying since early December, that this vaccine is particularly safe and effective, that it has now cleared not just the clinical hurdles, which were cleared before the vaccine was given emergency use authorization way back in December, meaning that the studies were reviewed, the data was clear, that these were safe and effective. But now it has cleared all the bureaucratic hurdles that need to be done. It does provide Pfizer a little bit more latitude in discussing their vaccine, and frankly, now they're allowed to advertise this particular vaccine. And so when we talk about the fight against this pandemic, it just gives us another partner who can now talk about and express how safe and how effective this vaccine is. So we hope that that will encourage many of the unvaccinated individuals who were either concerned that that the clinical studies weren't done over a long enough period of time, they were, or that they weren't reviewed in an efficient manner, they were. This is really just the bureaucratic paperwork that needs to be done for something to get full approval. And so we welcome the news. This is exciting for all of us. We've been waiting for it for quite some time now. And so hopefully this will just be another thing that can help us fight this pandemic.
Great, thank you.
All right, next up we have Portland Press Herald. Joe, give me just a sec. Okay, Joe, you should be able to unmute.
Yes, hi. Good afternoon.
Good afternoon.
So my first question is just simply, I know that according to the governor's order, all healthcare workers are required to get the vaccine. But with the Pfizer full approval, in terms of employers outside of healthcare, do you see this as being a domino effect, that there'll be more mandates for to keep as a condition of employment?
Yeah, so I can't comment on that fully, but we do know that there are several industries, particularly in the college and university systems, that had put the caveat in that once one of the vaccines becomes fully FDA approved, that they would require vaccination, whether that be for all faculty, staff, and students. And we know that other businesses are following suit. Paul, maybe you have some in your particular realm?
No, I agree, Dr. Jarvis. That's been the feedback that we've seen through employer forums and other comments from employers throughout the state and throughout the country, frankly, for that matter, that the full FDA approval was something that they were holding as a milestone from which they would then implement mandatory vaccination of their employees. For healthcare, it doesn't impact us because that direction from the state was already in place. But for non-healthcare employers, it certainly provides more guidance. Absolutely.
Okay, thanks. So my second question is about hospitalizations. And I know you just updated us with the numbers, and Dr. Shaw was mentioning this morning that even just compared to late last week, that we've seen more hospitalizations. And so I guess, is that something that you've seen at EMMC, just even over the weekend? And I know it's obviously a spike in cases, but if you could just discuss a little bit about what you're seeing in terms of hospitalizations in comparison to other times during the pandemic.
Sure. So I'll start off with just right now. So we did a media briefing last Wednesday where EMMC had an increase in its number of hospitalizations, but around our system it was not as dramatic. Now you notice that I mentioned many of our hospitals as having individuals who are positive for COVID-19 that are admitted, and quite a high number for Eastern Maine Medical Center. If you remember, when we talked about last December and January, when Eastern Maine Medical Center hit a high point of 55 patients that were positive for COVID-19, we're more than halfway to that number, unfortunately, and so that's the concern. And it appears that these individuals are sicker. We certainly have many that are in our intensive care units and are requiring ventilatory support. And so again, it's just that word of caution to go out there. For those of you who are unvaccinated, you are putting yourself and those around you at risk. And this is the time for you to get vaccinated if you haven't been vaccinated already. And if you're waiting for FDA approval of one of the vaccines, now you have that. And so I appreciate the opportunity to once again state the importance of vaccination.
Thanks, Joe, for your questions. Next we have WGME, Mal. You should be able to unmute now.
Thank you so much, Dr. Jarvis. Sticking on the questions of hospitalizations and what you guys are seeing at Northern Light, when might you have to start making changes to accommodate this influx of patients?
Yeah, so at Eastern Maine Medical Center, they've already made some accommodations in the fact that where we cohort individuals, and so we've now exceeded where our main COVID ICUs were. So again, that's concerning for us. We evaluate almost on an hour-by-hour basis at this point, not just here at Eastern Maine Medical Center, but across all of our locations, and basically to make sure that we can continue to meet the needs of our communities that we serve. While we are taking care of these patients who are sick with COVID-19, we still continue to take care of people who are in car accidents, people with heart attacks, people who have complications for their diabetes, and of course continue to practice good preventative medicine and care in our ambulatory practices as well. And so we are open for full business right now, but this is taxing our system. And so once again, everything that people can do to help limit the spread of this disease, it helps us and our healthcare workers. I can tell you many of them are disheartened to see what we're seeing now when we thought we had been through all this last winter. And especially when we had the hope that vaccines would help us. But we need everyone to be vaccinated. I've heard earlier today people comment that, oh, well, we reached the milestones that people had predicted would help from a vaccination standpoint. Well, one, we never did. We were talking about 80% of our total population, and we know that children under 12 cannot be vaccinated. That means more adults need to be vaccinated to hit that 80% mark. And this Delta variant is so much more contagious or spreadable from one person to another that it's causing us to kind of have a slip back, and only vaccination can help to prevent that from happening any further. So thank you.
Yeah. And you're talking a little bit just about how you're running at full capacity. You're still doing everything else that you were. I know last year a lot of hospitals ended up stopped doing certain procedures that weren't necessarily required. People didn't need it. It wasn't life-threatening. What other changes might you make at Northern Light in order to still be able to accommodate all these patients? Could you fall back on things like getting rid of elective surgeries?
Yes, that's a great question, Mal. So the playbook that we put in place very early on in the pandemic, expecting that we would see surges like they saw in the rest of the country, which thankfully did not happen, we still have on the books. We can certainly put any of those into play. We do know that we can share amongst our member hospitals as well as other hospitals in the state if need be. The last thing we want to do is put off any kind of procedure that may be necessary for a particular individual, but it is certainly something that we would have to consider if we saw rising rates of individuals being admitted to the hospital for COVID-19.
All right, thanks, Mal, for your questions. Next we have Hannah, who's Center Maine. Hannah, you should be able to unmute now.
Hi there, thanks, Andy. Dr. Jarvis, I'm wondering, is there any evidence beyond the anecdotal evidence that leads you to believe that this FDA approval will increase vaccination rates among the general public, perhaps historical precedent?
It's hard to say, and we won't know probably for a week or so whether that will translate into people changing their minds. We continue to hear that as a reason why some people are hesitant to be vaccinated, and I hope this removes that hesitancy from them. The good news is that here in the state of Maine, we have a very adequate supply of the Pfizer vaccine, so we can continue to vaccinate individuals who have decided now that they want to be vaccinated, even as we start talking about the third or additional shot of either Pfizer or Moderna for those people who are immunocompromised and fit a particular category. And then, of course, we look down the road as there's been discussion about giving booster shots in addition to just the people who are immunocompromised, but to individuals who were vaccinated over 8 months ago. So we put all that planning into place. We are prepared to meet those challenges, and I am very hopeful that this will be the thing that convinces a few more people to get vaccinated. Every one more person who gets vaccinated puts the rest of us in a safer position. But what we really need is everybody who is eligible to be vaccinated, and again, that's where our ask is right now.
Anna, did you have a second question?
Thank you. I do have a second question. So I'm wondering, in the most basic terms, can you explain what the FDA approval process looks like and what that means for this vaccine?
Yeah, so I'll do that as quickly as I can. Obviously, it is a long process, as it got started last February. And so we're well over a year since that process started. So typically what starts is that a product gets under development. There are safety things that happen in a phased approach to clinical trials. The initial phase is not in human beings. Then there's a phase 1-2 trial that happens with some certain human beings, and then it continues on to phase 3 trials. All during that process, the drug manufacturers keep in contact with the FDA, explain to them what they're doing and what their results are, and then they share their data. And that's what happened very early on in the vaccine process, is they shared their data. In this particular case, the FDA asked for more information. The Pfizer company provided that more information. And then the emergency use authorization came in because we were in a critical crisis, and it was not that they cut any particular processes. It was that they had the same people who review the clinical data do their clinical data, but then it becomes very much a paperwork process, making sure that every T is crossed, every I is dotted, and working towards, because it is a big deal when the FDA gives final approval. That means that the company can then market it under a trade name, not just its generic name. It means that they can start company sales and things like that. And so that process was what took so long. It wasn't that they were looking at more data. It wasn't that they were thinking that they had made a mistake with the emergency use authorization. That was always the correct decision. And actually, they had more time to be able to say, hey, yes, indeed, there are no long-term safety effects. And so it just made it that much easier for that process to occur. So really, the final portion after the scientists have reviewed the data is really just paperwork.
Thanks, Hannah, for your questions. Next we have Bangor Daily News. Caitlin should be able to unmute.
Hey, good afternoon, Dr. Jarvis and Paul. How are you guys today?
Very well, thank you.
Thank you.
I think my questions are probably best geared towards Dr. Jarvis, kind of staying on the hospitalization question. I'm wondering what you make in general those hospital numbers. Are you seeing the majority of those being unvaccinated people, and is there any geographic trends or anything like that stand out?
Yeah, so I can't comment from this morning's numbers. It typically takes us a couple of days after a weekend to kind of tease through all of that information. As of last week, the greater majority of these individuals were unvaccinated. Numbers of more than 80% and in some cases more than 90% were unvaccinated. We did see more of a trend across the state that they were coming from our more rural locations and not from our more urban locations. But again, from today's numbers, I don't have those specifics. Again, it takes us a little bit of time to crunch those numbers.
Okay, and I'm wondering if you can just explain a little bit more when you were talking about changes to your cohorting, if you can kind of explain what that means.
Yeah, so at Eastern Maine Medical Center, we have several intensive care units. We had dedicated two intensive care units for the care of COVID-19 patients. We exceeded the capacity of that and therefore then had to cohort into one of our other intensive care units. So basically, we're talking about three of our intensive care units now have COVID positive patients, and that's always in flux. We're hopeful that we'll be able to have some people recover and be able to transfer people out of that particular setting. But it is concerning for us to see that, and that's really what we saw as we talked about the surge in numbers last winter. But what's concerning here is it seems to be a higher percentage of people are requiring that of all the people who are admitted to the hospital.
Thank you.
All right, thanks, Caitlin. We have Maine Public. Carol, just a sec. All right, Carol, you should be able to unmute.
Hi, good afternoon. Can you hear me?
We can, thank you.
All right, thank you. I wanted to ask you a little bit about the numbers of children. Do you see any children being admitted to the hospital due to COVID at this point? Are you seeing pediatric cases?
So I don't have any numbers outside of Eastern Maine Medical Center where currently we do not have anybody under the age of 18, but that could change. I do know that there have been some cases reported around the state, but I don't have anything more specific than that.
Okay. I don't know if you're at liberty to, or if you can even address this, but what is the process of getting a vaccine for those 12 and younger, or under 12?
Yeah, all I can say is that we know that particularly with the Pfizer vaccine, that they have asked the FDA to review that, and there's consideration there for emergency use authorization. We don't know about Moderna, and Johnson & Johnson has not really been talking too much about their vaccine under the age of 18. And so right now it is really at the hands of the FDA reviewing whatever data that they have been sent by those vaccine manufacturers. And we're just waiting. I am hopeful that we will see that at least in some form shortly, sometime during the fall. But the head of the FDA has stated that they are looking midwinter as an end point, and hopefully they'll be able to make the emergency use authorization sooner than that.
All right, thanks, Carol. Next up, we have Ellsworth American. And you should be able to ask your question now.
Hi, thanks for taking my questions. I have two questions. One is, I'm looking more specific to the Blue Hill and Ellsworth area, is if any staff members have given notice because of the vaccine requirement?
I'll let Paul answer that question.
I know we've had a small number of staff give notice due first to the flu shot as a job requirement from the state law change, and also to COVID. I'm not sure about Blue Hill or Maine Coast in particular.
All right, well, thank you for that. And my second question is, so masking in schools is a hot topic, and so I'm curious, how much protection does it afford your child to be masked if none of their classmates are?
Yeah, that's an excellent question, and I know one that's making the rounds on social media. So first and foremost, we know now that masking not only protects the people that surround the person wearing the mask, which is what we initially said during the beginning of the pandemic, but also that it protects the mask wearer. What masks do, and whether we're talking about a 2-ply cloth mask or a procedural or surgical mask, or one of those N95 or K95 masks, is they simply set up a barrier so that the droplets that come out of our mouth, you can see the ones that are fogging up my eyes, my glasses right now, which may contain viral elements, it just protects that from being spread directly in front of you. It also protects you from breathing them in if somebody else were to cough, sneeze, or talk loudly in front of you and spread that. So we know it is a two-way protection. As well, how do we know what the protection level is, though, for a single person who's in a room being masked and nobody else is? We can't really quantify that. That would be a very difficult study to do and provide. What we do know for a fact, though, is that when everyone is masked, that protects everyone in the room to a level that wouldn't be done if even just one person wasn't masked. And so that's the reason why Northern Light Health has supported universal masking, and that's the reason why you continue to hear providers around the state talk about universal masking.
All right, thanks, Dan, for your question. Next we have Leslie Landergan, of Scott Bay Press. Leslie, you should be able to unmute.
I am unmuted, thank you. I'm not sure who my question is for, but it's pretty simple. Are you anticipating ramping up your vaccination systems for the third shot or the booster shot?
Yeah, so I can answer that question pretty easily. Yep, I can answer that question. So for people who are immunocompromised and meet the criteria that was set out by the CDC and the FDA, we are administering those third shots now. I'll remind people that is a very limited number of individuals who would meet that criteria, and that we really ask that they have a discussion with their provider before getting that additional shot. I caution to use the word booster because, again, this is really a completion of the original series that they had, because we felt that a third vaccine dose could boost their immune system even more. So they should reach out, because there may be some implications to the treatments that they may be undergoing, and so that's the reason why we ask them to reach out to their providers. As far as the proposal for booster shots, meaning a third shot for people who do not have certain health conditions that require them to get a third dose as part of their primary series, we are continuing to just have internal discussions about how we would manage that and what plans we would put in place. We do feel that with the fact that access to vaccines now is readily available across the entire state, that the changes in particular for the Pfizer vaccine in terms of storage and transport make it that much easier for us to be able to get the Pfizer vaccine in particular, but also the Moderna vaccine out into our smaller communities in a more efficient manner, so that we can actually vaccinate people where they live rather than have to have them drive, in some cases, 2, 3 or more hours to come to a large-scale site. If we need to enhance any of the things that we are currently doing in order to maintain our vaccination rates, we will do so, and we can certainly dust off any plans that we had in the past, but really we would like to keep things at home. We would really like people to be able to get their vaccine in a more convenient, more timely fashion than we saw before. And again, part of that really has to do with the fact that our vaccine supply, particularly for Pfizer and Moderna, is very good in the state, and so we should be able to reach out, and we will continue to work internally. And if something changes, we will certainly reach out through the media and through our social media networks. Thank you.
Thanks, that's all I have.
All right, final question is in the chat. I'll read it to you, Dr. Jarvis. Chris from New Center, Maine asks, vaccination rates across Maine were very low in July compared to previous months, but now we're seeing rates rise again. What do you think is driving that upward trend?
I am guessing that upward trend is being driven by people's fears over the Delta variant. You know, we did look like we were doing very well as far as the pandemic goes, when we talked about the end of May, June, and when we started to talk about those summer months. But this Delta variant really took the nation by surprise, and you can see what's happened in states around the country where they are now being devastated, having to close their hospitals because they're full, having trouble with EMS services because staff just can't keep up with the numbers. That's what we do not want to see here in Maine. And so I'm hopeful that people are getting vaccinated because they know that this is the best way that they can protect themselves, their family members, and their communities. It's certainly what we need to do to keep our numbers low. You know, when we talk about the patients that we have in our hospitals right now, we want that number to be even lower. We don't want to see this continued rise. And so vaccination is a primary portion of what we need to do to protect all of ourselves. That, in addition to good hand washing, appropriate physical distancing, those are the things that we need to continue to do, and then masking just adds on to that. And right now, most of the counties in the state of Maine fit under the CDC's recommendation to wear masks while in an indoor public place. Thank you all. Thank you all for joining us this afternoon.
Thank you.
Thanks all. Just one more thing before we go. Karen mentioned this in the chat at the beginning, but we do have the high-quality video file available at the briefing. If you want that, just let us know in the chat or follow up by email. We'll get it over to you as soon as we can this afternoon, maybe 3:30ish. And again, just ping us in the chat. So thanks again, everyone, for joining us today, and have a good rest of your Monday.
Thank you.
Thank you.